Morning all. Thanks for coming. This is a really, really important topic, and I'm going to stay to hear the next speaker, and I'm afraid I can't stay after that, unfortunately, but I'm going to look forward to hearing the outcome of these sessions. I know there's going to be 3 across the county, this being the first one, and I really want to hear, it's unfortunate I can't stay to hear back from you, exactly the sort of issues that you're facing on a daily basis and your ideas about how we can work on this to really get a child focus into this important topic. So why is it important? I mean, the hidden harm strategy, if you've had time to have a look at it, it really describes the situation for a number of children and young people in this county and elsewhere when their parents have problems with either alcohol or drugs. And the needs of children in those situations still are overlooked on a frequent basis, and it's how we can bring together that perspective from an adult services and adult perspective, and to also incorporate the views and the needs of the children. And if I can just share with you, I was working in substance misuse myself between 91 and 95 in East Sussex. I was the Commissioner for Substance Misuse within East Sussex Social Services, and also coordinated some interagency programmes around both drugs and alcohol. And interestingly, at that point, drugs were treated very separately from alcohol, and clearly, as we know, alcohol is the substance that causes most harm in terms of prevalence, not just for the adults themselves but also for children. But clearly there are issues, and in fact I don't know if you listened to the news this morning, it was talking about adult drug users and the impact on children on the news this morning as well. And from that time ago when I was working, which is, it seems almost in the dark ages in comparison with now, the adult services and the treatment, and I was working in adult services at the time, hadn't picked up at all on the impact of the children in those families. And they were very much still having an adult focus. And it wasn't until I went with a number of colleagues to Hamburg, in fact, in Germany, and we looked at some of the services over there, and they'd picked up much sooner than we had on the need to look at this as a whole family issue when there were children involved, not just about the concerns and the interests of the children, but also the fact that you could work on the family life to bind that together, and you'd get better success from the treatment programs from adults when you were focusing in that way. And subsequently, and I think it's still going, there were a number of family projects that were commissioned throughout East Sussex, which at the time also included Brighton and Hove. And in fact, we had a family-focused rehab there based the Phoenix House system. So I saw what could be done, and I think what's disappointing still is that we are, 15 years on, still struggling with these issues and thinking that, having to remind ourselves and to remind colleagues, because I'm sure we've got the enlightened here already, but reminding other colleagues and other agencies that you have to have a whole family focus, and that you have to look at the needs of the children and young people in those circumstances. And it's very poignant in the hidden harm strategy. It's got plenty of photos, but also some case studies there of children who feel, the family's out of control. If you haven't got that solid basis going on in the home, if sometimes your mum or your dad are out of control themselves because of their needs and are not putting you first, that you end up either suffering the harm from that, but also end up caring in some ways. And so there's that twofold issue, both the harm that's happening to the children and also that perspective around themselves acting as carers. And clearly that is going to get picked up most often through the schools. And I know that schools are picking that up and sometimes don't know where to go, because is that a child issue or again is it an adult issue? And I'm hoping that out of this strategy, which has got all the good intentions in the world, we need now to come together with some real actions about how we would know where to refer to, how those agencies will bring all of those perspectives together, and what actually works, where is the evidence of what works around children and families. And we were seeing, I'm sure, mostly in London, there are already some experiments going on with family courts, whereby if the adults have got substance misuse problems, particularly drug problems, how the courts might work on those. Instead of immediately moving into a punitive system, you might set a series of tariffs whereby if the adults commit to rehab, the families stay together, they have to accept the support. And there's, the courts themselves and the judiciary are saying this is a far better way to treat parents and to treat families if you can really work through those issues with them. But obviously from a child perspective, I would say, and we may well have children and family social workers in the audience with us today, it's always that balance, isn't it, from a child perspective about how far you can really keep that family together, how far you think there is the possibility of getting through these problems and that the children will thrive eventually. Or does there have to be a line drawn where you feel the children are suffering such harm that you have to remove them from the situation? And then clearly, as we all know, you then often get into the situation of repeat removals. And certainly from all my experience and certainly being Director for Children and People in Suffolk and now in Kent, the prevalence of substance misuse, both alcohol and drugs, within removals of children from families, very high indeed. In fact, I just checked our stats, there's some stats in the report as well. 50% of our looked after children in Kent, the parents have got substance misuse issues. Now that won't be the only factor for removing them, but it clearly is a significant factor and it's very high, isn't it? And then it's 56% of our children on the Child Protection Register, their parents have substance misuse issues. So you can see the scale of the problem and the impact it's having on children and young people. And I suppose what's more worrying is that there'll be even more adults out there who have alcohol problems or drug problems and either it hasn't come on the radar, the impact on the children, and the risk isn't being picked up. And so it is really important now that we bring the whole system together, both the adult system and the children's system, and putting the whole picture together. What we have to do in highlighting the problem, which I'm sure you're already aware of, is really highlight what works as well. So we've got something to hang on to. Right, we know what the problems are, how we're going to move through, and I'm hoping that from today and the other two sessions that are going on across the county, that's the focus now. We've got a strategy in place. It's been very well worked through. It's got the commitment from all of the agencies. It's been signed up to by the Kent Safeguarding Board, as well as I'm sure from the KDAT board itself and all of the other agencies. So now we know this strategy is in place, we know the issue. One, how are we going to make sure the systems are talking to each other and that we really have got that whole picture of the family and the family issues. And then two, how are we going to respond to them? And it talks in here about using much more the common assessment framework, which is something that was put into place, as I'm sure you know, emanating from the Children Act 2004, getting this whole system approach. Common Assessment Framework, the CAF as it's called, isn't well developed in Kent. I have to say people are tending not to use it as a way of really looking at a whole family problem. They're tending to press the nuclear button, and that's why we've got so many referrals coming in through to our children and families social care teams. And it would be really encouraging if out of these sessions and beyond we could look about how, if a problem is being identified, either from an adult perspective or a children's perspective, how can we use the Common Assessment Framework as a process of people getting around together with the families themselves, because this has to be a family-focused model, about identifying where are the issues and where are the strengths, and how we can work on those strengths for that family and help to work them through so that everybody thrives, both the adults in the situation and the children in the situation. So I'm really hoping that out of this we will really get a real process where people early on at local level are grouping together around families. And then I think we need to look at what is the evidence-based practice about what works. You can look at the very high end, and I was talking about those family courts where they're looking, right, okay, if it's a question of either custodial sentence and or removal of your children, and you do not want that to happen, how can we work with you to bring you back from the brink to which you've come? So if you look at that high end, I think there are a number of examples both here in this country and in America and other places where we can use some evidence-based practice, and I'm hoping that the next stage of this will now to start to link in, well, okay, here's the strategy, here are the actions, here are some of the solutions. There are other things already going on in Kent, and it mentions here the Sunlight Project, and it mentions some pilots, I think it's in Swale and Gravesham. where we've got people grouping around those families and look at some of the practice that we can bring into there. And again, I'm hoping out of these conferences we'll look at those pilots and see how well we can do. But I think there has to be a sense of impatience and impetus and pace here, because to have a few projects going on in the county and a few pilot projects going in 2 districts, we've got 12 districts, we've got huge issues here as we have elsewhere. There has to be some urgency, I think, now. If we've got those projects going, we know what works elsewhere, let's try and roll that out across the whole of the county. And I have myself seen some really good work going on, particularly at the high end, I have to say again, where a project sponsored by probation, my own directorate's put money into that, and it's working with a voluntary organisation called St Giles, the Cafe Project, where you're working with offenders or people already on the brink of prison and custodial sentences, who have families, and bringing them together. So it's Children and Families Enterprise Project, it's called, and it's trying to give people hope. It's picking up issues of housing, issues of debt as well. It isn't just substance misuse, is it? It's that whole picture about what are the problems that family is facing, and keeping those families together in the interests of all, but particularly for those children. And so I think we have to say, right, from the child's perspective, what is good parenting? How can we get good parenting from them? How can we make sure that they're thriving in the home setting, that they are taking up the opportunities available to them, like all children, to have a happy childhood, and also, of course, that they're thriving in a school setting and that they're achieving. So I think, colleagues, we really need, out of these sessions and the other 2 across the county, to give ourselves a bit of a backbone injection now. This is an issue. It's a big issue for Kent. It's a big issue for the whole of the country. How are we going to really challenge ourselves and get ourselves all working together? We know what the issues are. What are we going to do to make this work next? So I think this strategy is really important. It is signed up to by everybody, the Kent Children's Trust, I should say, as well. I've talked about those projects that are already working, the Adults Treatment Systems Change Pilot and the Sunlight Project in some districts. And of course the Young Carers projects will also be picking up on this issue themselves. We do need to look at the evidence, the outcomes, the strategy, as well as the commitment, and balancing how we keep the families together with that risk to the child, and that key judgment about at what point you take the intervention and how far we do that. So I think, as the strategy is saying, this needs to be embedded in all our practice, including our schools. So we need to make sure that our schools can pick up concerns. If the child isn't thriving in school, what is all that about? If they know that the parents aren't particularly getting the children to school on time and there appear to be issues of substance misuse, how can they flag that up? And as I say, we need to work very much on the common assessment framework. How can we get that really being worked well throughout our processes in Kent? I think, as most of you know, we've got a safeguarding inspection going on at the moment. We've got a team of 6 Ofsted inspectors. They came in last week, they're here with us this week. They've already picked up on this themselves. They were talking to me the other day and praising, in fact, the KDAT team for working with our youth offending service, because if there are substance misuse issues in the adults, there may well be, not always, but there may well be issues for those children as they become adolescents as well. And there's a KDAT and YOS partnership now screening the young adolescents that come into the arena of our youth offending service. We need to be doing the same within our care system. So if we've got children coming in as adolescents into the care system and we have increasing numbers, we need to also be screening them for their own substance misuse issues. So there's this whole system approach that we need to be having. So I think I've reiterated my own personal commitment to this. I've seen it in practice in Kent. I've seen some really good examples, but it is a worry for us. This is a big, significant issue. There are high numbers there, and I think my own personal concern, and it's not a criticism of Kent as it is anywhere else, is that in some ways we don't seem to have moved on sufficiently from when I was doing this work 15 years ago as the Commissioner for Substance Misuse in East Sussex Social Services. Somehow, although we knew then that this was an issue about hidden harm, and then of course there was the Advisory Council for the Misuse of Drugs report. I forget the date now, I think it was around 2000, wasn't it? 2003. We've known that all this time. Somehow we're still sitting here looking together about how can we put together a proper evidence-based practice to get these outcomes for children and young people. So I'm really hoping we're going to get some good examples from elsewhere. I'm hoping that you yourselves will have time in these sessions to share your own personal views, and I'm hoping that we will get feedback from these sessions that we can then take to the Kent Safeguarding Board and elsewhere to really now embed good practice, because it's such a high issue for us. So thank you very much. Look forward to sitting here and listening to the rest of the speakers until about 10 o'clock and hearing from you from these sessions. Thank you.